Now you can notice that the two marks are very similar, but the main alignment mark is slightly longer. It's a good idea to make them, if they are very close by, to have slightly different appearance, because they can be confusing at times. Now we go by instilling viscoelastic. The trick in doing a toric IOL is actually making a little smaller axis than required. So in such situations I do sometimes make slightly smaller capsular axis. विस्कोएलास्टिक देना बच्चे, सर हिलाइएगा नहीं. There. Now remove the plug of the capsular axis, and then we're going for a cortical cleaving hydrodissection. There, you saw a wave. We depress it to see whether it was at the cortical plane and capsule plane. No. Now this we will attempt another one, and there we saw a reflux wave. Light को देखेंगे सर, बढ़िया चल रहा है. Now since it's a soft cataract, Phaco 5 birotator. Light को देखेंगे सर. Now when you're operating a small soft cataract, I prefer extending my sleeve slightly anterior. It prevents a sudden entry into the cortex or the nucleus. Light को देखिए सर. There. So shorter exposure of the tip makes it a little comfortable, because you can be more predictable while aspirating, because you don't need to use much phaco power here. I'm using a 5 phaco power, and irrigation aspiration. So the delivery of the central nucleus in a soft cataract anteriorly has made the job much easier. So I usually use a D-flip technique for soft cataract, or a nuclear delivery into the anterior chamber, simply by doing a hydrodissection. Even though you have a smaller capsular axis, if you do your hydro procedure well, you are able to deliver the main part out. सर सर्जरी नियरली ओवर हो गया आपका, बस लेंस डालना है मुझे. Now we do hydrojetting to clean the posterior capsule. There. And once we are through, we will have a pristine clear posterior capsule. इसके बाद बच्चा ये लूँगा, थोड़े से फाइबर्स हैं. Now we are going in with the Vivity Toric. Now again a hydro insertion. Now since this is a little yellow colored lens, I'm using a 2.2 millimeter injector, though my surgery was through 2.8. लाइट को देखते रहिए सर. कौन है, वेट कर दो बेटा. कौन है? बॉट लाइट ठीक है मेरा. Now we just wait for the IOL to open up. Meanwhile we utilize the time. Irrigation aspiration दे दो मेरे को, to remove those cortical fibers. Always align the lens slightly 10 degrees short of where you want to place the lens. I'll utilize the time what the lens takes to open up to do my aspiration of those cortical fibers. The lens is still taking a little long to open, because the weather is slightly OT is cold, and these lenses would take slightly little long to open. Surgery technically is over. We are just waiting for the lens to open up, and once the lens is open, we'll just go and align it to the required axis. There, the lens is opened up. Now I avoid using a lot of viscoelastic because of. बच्चे वो रोटेटर देना मुझे, वायर रोटेटर देना बेटा. So now the lens is open. Now we have to align it to the principal axis. There you are. The lens is exactly at mark 13 degrees. And you can even see the central part of the Vivity lens. There. So surgery is gone off perfect. बहुत बढ़िया हो गया सर्जरी सर आपका.
मना कर दिया वो बता. बोल रहा था 2 कैटरैक्ट हैं, एक हार्ड कैटरैक्ट भी है.
बहुत बढ़िया हो गया सर सर्जरी आपका.